morning.
How are you?
All right, I survived the earthquake.
I was wondering about you. When I saw it was all up your way, I said, "Well, did it hit over in y'all?
It sure did.
Did it? Wow. Are you okay?"
I'm fine. I just didn't know what was going on. If I really didn't. I didn't realize I had to. I did. I just didn't know. I thought it was something completely different, but it was. I had never been through one, and it's like
Oh,
I'm sitting here
wow.
working at the same spot, and I just heard all this noise, and the house started shaking, and I got a little dizzy,
Oh,
and I'm like, "What
wow.
was that?" And I went to the door and I'm like, everything's fine. Ain't nobody saying nothing. Ain't nobody outside. I came back to my desk and somebody in the chat who lives in New Jersey said there was just an earthquake. I'm, oh my God, that's what it was.
Oh, wow. Wow.
And then it was another
We
aftershock in the evening.
Oh, really? Was
Mhm.
there wasn't any damage or
No,
anything
it was
near you?
smaller than,
Okay.
yeah. The first one was a 4.8. The aftershock was a 4.0.
Oh, wow. Well, I'm glad to see you survive the earthquake. I remember,
Yeah.
oh my God, I was I guess a teenager, maybe preteen or something. And we had an earthquake here. And I was at church. It was on a Sunday. And I was at church. And it was after service, but we had an afternoon service. And so we had a hall. It was Bedford Hall. We had a hall. And I'm sitting at one of the tables because I'm tired. And I'm like, just got my head down or whatever. And I'm thinking it's me. I'm thinking I must be rocking or whatever. I'm not even really cognizant of what is really going on. And I'm thinking I'm rocking. And then I look up and I'm like, no, I'm not doing that. Something is shaking me. And I'm like, oh my God. So I got up and walked away and went to the kitchen. So the hall was like an area that they set up for like banquet tables or repasses or whatever. And then a few steps down the hall was the actual kitchen area. And people were in the kitchen either cleaning or preparing or something. So I was like, "Did y'all feel that?" And they were like, "Yeah, yeah, we heard whatever." And no sooner I said that, we heard this loud crash. And I'm like, what in the world? And so we go back in Benford Hall, and there are chandeliers in the ceilings in there. It was real back in the day. It was gorgeous. It was a gorgeous space. Um, but the table that I was sitting at, there was a chandelier above it. That chandelier crashed down right there where I was sitting at. And
Wow.
I was like, oh my God. They was like, oh my God, we so glad you got up, that. And I was just like, wow. Just my y'all wouldn't even know me now. My whole little life would have been snuffed out. But he had a plan. He had a
There you
plan.
go.
He had a plan.
Look, you know how they say, look, but God.
But God, he had a plan. And look at us now. Look at us now. Okay. So how was your week? I know I'm going on and on, but how was your week other
It
than
was
the earthquake?
it was pretty good. I mean, I'm glad it's Saturday.
Sir, that's a word right there. A whole word. It's been crazy over here in these streets. I don't know what's. I'm like, is it the eclipse?
I
Is it
think so.
because I mean it's now a whole holiday over here. I don't know about where y'all are, but stuff is closing down. Schools is closed. It's a whole holiday. Like
We gonna miss it, so it's not gonna really see. I think y'all are in the line. So
it's a whole holiday over here. When I tell you, hell, the grocery store might be closed. I don't know, but everything is like stop. Go find. There's certain areas they're giving you maps of where to go. Glasses are being distributed. It's a whole thing. So, I did say I was going to try to play around, but I have line dance class on Monday, so it better hit before my class.
I have a coworker in Indianapolis,
Uh-huh.
and they've been planning this since I want to say February or
So they got
March.
a whole party going. Wow. Yeah, it's like anything for a party, huh?
Mhm.
Anything for a party. All right, all right. Well, welcome everybody. Welcome everybody to our Saturday morning tea where we discuss all of the things, apparently. No, but where we discuss health information, news, education, certification tips, and entrepreneurship. really the revenue cycle at large. And as you come in, don't forget to hit the thumbs up or like button, and you can also hit the comments and let us know where you're from. Uh-oh, we see our on the street correspondent, the crafty coder is in here. Good morning, good morning. All right, all right. So I'm Clarice Warner. I'm the girl with the pearls, the founder and senior education director of the Professional Reimbursement Network, LLC, where coding education is key. And PRN is a healthcare compliance consultancy located in Cincinnati, Ohio, that specializes in revenue cycle and regulatory compliance in education. Now, let me ask you, do you know what it takes to be a certified marketable medical coder? Do you? Well, before I introduce my co host that we've been talking to already, let me share with you information on a free 99, yes, free email course on the 5 steps to become a certified marketable medical coder. Are you interested in medical coding, but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. All right, all right. See, I'm still over here jamming to the beat. If you are interested in getting more information about the 5 steps to become a certified marketable medical coder, wait, I still got a message on there. Okay. Feel free to check the video description for the link. So, joining me today is my co host, Mr. Jesse, the registered trademark. Put some respect on his name, the coding nurse. Sir, introduce yourself and tell the folks all about you.
Good morning, everybody. My name is Jesse. I live in Philadelphia. I have been in healthcare for a very long time. In 2014, I transitioned into HIM. I started doing risk adjustment coding. And in 2020, during the pandemic, I created a company called the Coding Nurse LLC, where I help nurses and other healthcare professionals with a clinical background transition into the wonderful world of HIM.
Yes. And how is that going?
It's coming along.
Okay.
I'll just be glad when this contract is over.
Okay.
Did you get an email?
Uh-uh. No. I was
Okay,
gonna ask you about that in the meeting after me, but no, I did not.
okay.
And I was gonna like, well, did I miss something?
Because I got
Maybe.
one, so I'm that's why I had to check.
Did
But
it come to your? It's from your
yes, it's
company.
from Optum.
Mm-mm. I'll look and see if it's in spam or something. But now,
Okay,
where did you send it? Wait, that'll
to
be another.
Ohio PRN at
Okay.
me.
Oh, the me one.
Mm-hmm.
Okay. Well, wait a minute. I might have got it. Hold on. See now you. That's a whole different email setup over there. Um. Wait a minute. What is this? Uh, no, I don't see. I don't see. I don't. I see. I don't. No, I don't see
Okay,
anything in there. Yeah. Okay. Unless it's spam or something down there. So I'll look in the spam. I was just checking
okay,
the thing, but I'll double check and touch base with you. Okay. Let's see. Good morning, Tanika. Good morning. Good morning. Uh-oh. We having problems with screens here. What is happening? Good morning, healthcare business consultant. Man, where you been?
yeah,
Hey, how are
Molly,
you?
how you
Right.
been?
All right, all right. So, um, before we jump in, let me remind you that this is a conversation and you can add and join in the conversation. So don't be shy. Use the chat. Put, you know what? Well, I'll talk about that later. You can add your opinions in the chat. All your opinions are welcome, whether they're in support of or against. They're welcome here. We're going to talk about what we're going to talk about anyway. So and we may comment on your opinion. So let's have a dialogue. Let's talk. Um, but if you have a question, please put Q first so that we know it is a question and we don't miss it. Girl, that is the truth. She said
Yeah,
life has been life, and
yes.
y'all. Yes, yes, for everybody, everybody, everywhere. It's crazy. It's crazy. Okay. So, for those who are just joining us or watching the replay, today we're talking about behavioral health, fraud, waste, and abuse, and uh, the SNF rules that have been updated. So, the proposed SNF um, information came out, and we're going to. One of the things piqued my whole curiosity, and I was like, you know what? I don't even have time to read all these thousands of pages just yet. But this part right here, we could talk about this. So, but first, let us get into our church announcements. Oh, and I got something else to share with you in the meeting after the meeting related to the church announcements. um, see, I'm probably sleep happy because I went to bed at 7 o'clock p.m. and then I woke up at 1 and I've been up ever since. So
Lord.
it's crazy. It's crazy. Okay, where's my? Oh, here we go. Where's my music? Have a church announcement now. Okay. Got it. Here we are. Here we are. I still owe you a whole period. I gotta make some fans of I don't know if you want a fan. Send me an email. I'll shoot you a fan as well. We'll be out here fanning. Okay, so today I really don't have a church announcement other than to say, don't forget that HIP Week is coming. HIP Week is on its way. That's Health Information Professionals Week 2024. It's April 15th through the 19th. My other church announcement is that we will not have a live next week, but I'll put something together for you. I'm thinking about doing the best of. I don't know how much time that's going to take me, but I'm thinking about doing that. If not, there will be something for you to chew on, some tea for you to sip next week. It just won't be live. I'll be at the Healthcare Compliance Association conference in Nashville, so I'll be traveling on Saturday morning. I still don't know whether I'm supposed to be there Saturday morning or if I'm leaving Friday night. I haven't decided, but either way, I'll be traveling. Mr. Jesse, I didn't know if you had any church announcements that you wanted to share, or our on the street correspondent, Crafty Coder. Are there any church announcements you wanted to share?
In our meeting after the meeting, to keep doing all this traveling, you're gonna have to share your travel partners and what kind of perks you need.
Sure. Now, well, yeah, we will. Let y'all know all the tea for real. Okay. All right. So let's get into this. So first and foremost, let's talk about, and this was brought to me by our on the street. Oh wait, she got a message. Nope, stay safe out there, y'all. Yes, ma'am. Um, this information regarding the fraud, waste, and abuse was brought to us by our on the street correspondent, the Crafty Coder. So, Cativity, I hope I'm saying her name correctly, had uh, an article or a post on um, LinkedIn, right? Yes, LinkedIn, talking about behavioral health. And we've talked a little bit about behavioral health and compliance related to this area. And in this article, it says that, unfortunately, they're targeted by bad actors. One of the reasons I think they're targeted by bad actors is because there is so much money of late being thrown in, and rightfully so, being thrown into the behavioral health space. We've we've come from a pandemic. Folks are in need of all types of therapies and treatments and just mental health services at unprecedented rates. Just to have a conversation with some, as even as the healthcare business consultant stated, life is lifing, and life is lifing for a lot of folks. And because of that, um, the government has recognized, as well as some of the commercial payers, the need to make sure that these services are available for patients. Um, and so the money is out there. And then the way in which it's not limited to physicians or psychologists, or there's like a whole team. And in a lot of instances, the whole team can actually bill for some of the services under supervision, um, which makes it easier for your licensed independent, because they have a license and everything is tied to the license. Your licensed independent social workers, your licensed professional clinical counselors, um, all of the people can pretty much open up shop and provide these services. Um, this Medicaid in all of these states are it's there's a whole playbook out there on how to do that. And as in all areas of healthcare, you do have those folks out there, and we've talked about them several times because we've looked at what has happened with the DOJ and these bad actors, and folks just off the chain. But the reason why this particular article was interesting to me is because some of the codes that are used are codes that some of your non-traditional, like your LISWs, your LPCCs, those practitioners who can practice independently under supervision use. And so I just wanted to put the heads out, or put the heads up and say, hey, watch out. Make sure you're in alignment with what your treatment plan says, what has been assessed, all of the things, um, because we all know uh, data analytics is a real thing. We're proposing to use it. We're proposing to learn it and understand it, and the government uses it as well. The government can easily pull some data to get a understanding of what a practitioner's case mix looks like, what a practitioner's billing patterns are, etc. And so I think that was one of the, and not necessarily even the government. I mean, you any of these payers can do this with the right information. Um, but the other thing is, it's kind of difficult. Behavioral health is just a different animal itself, because there's no physical symptom, or there's no physical something that you can tangibly say. It's really it's of the mind, and understanding and treating those types of behaviorals or mental conditions that someone may have. So it's a little more trickier to kind of define what's medically necessary, if you will, those treatments. So it's really documentation in this area is crucial, very, very crucial. So in this case, the Cotivity's Special Investigations Unit, and yes, folks got out here got these types of units that's looking and watching, and that's what they do. That's what they do all day. See what's going on. They flagged some suspicious activity from a particular provider that showed them some just strange billing patterns. They were looking at HCPCS codes. So another thing, particularly with behavioral health, substance abuse, mental health, um, the practitioners at the other end of the spectrum, the licensed practitioners, um, your peer recovery specialist, your qualified mental health specialist, those people who, again, now they can't open up shop, but they can still bill for services under supervision of somebody else based on the person's assessment and treatment plan. They use HCPCS codes. So most of the stuff is all in that realm. Your psychologists, um, sometimes there are medical services that are involved, RNs are involved. All of those folks, depending on what the service is, primarily most of them use like your traditional CPT codes sprinkled in with some HCPCS codes. But these other folks on the other end is primarily the HCPCS coding. So they were looking at H2014 and T1017. Um, Again, these are codes that were primarily used for Medicare and Medicaid and other government services. So these were the codes that, um, if you want to talk their language, this is your first uh, love language to them. To give, these are the codes that they develop. These are the codes that they want to receive back. Now, you can still, of course, you'll definitely use your ICD-10 codes for diagnosing. Um, and again, depending on what the service is and who is providing the service, CPT codes are also can be part of the mix. So HCPCS code H2014 is under alcohol and drug abuse treatment services or rehabilitative services for 15 minutes of skill training and development. And with these codes, they're often a unit of service. Most of the time, that unit of service is time. So they'll have like a 15 minute cutoff. And so if you're spending 45 minutes, then that's your 3 units, et cetera, et cetera. So that's how all that works. The other code is T10 T1017, and it's listed under state medical emergencies, again, for 15 minutes of targeted case management. So you also have, I've forgotten, left them out. You also have case management services embedded in this as well. And so you have case managers who can also bill for their services, again, under supervision of someone licensed. So in this case, this particular provider billed 7 members for these codes exclusively with the same number of units for each code for each member 100% of the time. Low hanging fruit, low hanging fruit, low hanging fruit. Um, the provider also billed 3 hours for each member on each date of service. I mean, they should have just said, "Come on in, bring your wallets. Come on in. We got our checkbook. Here we go." But anyway, so in addition to submitting a suspiciously high volume of identical claims, the provider listed billing practices that reflected impossible hours. We talked about this with somebody else before, um, and even that term, impossible hours. The data show that the provider billed several dates of service for 2 sibling groups of 2 members, each group sharing a home more than an hour away from the provider's office. The providers billed 3 hours of service per day per member in both of these groups, despite the distance, spending 6 hours in each home. Additionally, the provider billed several consecutive days in a row that included spending 6 hours in one home, then spending 3 hours in another home located 90 miles away. This would mean that the provider claimed to have spent 6 hours in one location and then allegedly drove hours away to spend 3 hours at another home. All of these abnormal distances and services proved problematic and likely a case of impossible hours.
Molly
I
has a
see a
question.
question. I
Yeah.
see. So the provider was doing the billing and coding. I'm not 100% sure, but the provider is ultimately responsible. um, it didn't say. They just said the provider. Um, yeah, it just said the provider. But again, ultimately, the provider is responsible whether or not they actually submitted the claim. They're attesting to the validity and the accuracy of the information that's on that claim. And so, if they didn't directly, they should have known. But somebody had to tell them what they were doing, especially if they're saying that they traveled to a home and spent this amount of time and so on and so forth. Right. They were just pleading to be caught. Exactly. Because this is way, way, way. So then the investigators began oh wait a minute. Oh wait. Here's some more. They also determined that the provider's listed location was a residential home, not an approved location for individuals to go to receive behavioral health services, making it unlawful for services to be provided at this location. This listed property owner of the residential homestead was neither the owner of the business nor the rendering provider. And so this information was verified through the local county tax appraisal district. Now, I don't know where, I'm not seeing where this was. But when I tell you over here in these Ohio streets, there is a whole accreditation certification process in order for you to be able to provide these behavioral health services. There is someone is physically, or I take that back. Well, it depends on when they did this, because it was, if it was in you say it's the audacity. If it was in COVID, there was a lot of virtual reviews, so they weren't necessarily coming to the physical locations. But I know here they come to the post COVID and pre COVID. They were coming to the actual physical locations. They needed to see what it looked like, what had happened, and there are certain physical things that these offices need to have. Um, if Yeah, and you have to be a business. You have to be registered as a business in your state. All of the things. So I don't know what state this was and how they got that part off. That again, that was very interesting to me. um, so the investigators reviewed claims data for the provider's 18-month billing history, which identified potential excessive services. Again, they kind of did a pepper, if you will, looking at their peers and comparing what those codes look like. The provider received 7 times more payment for HCPCS code T1017 and 21 times more payment for HCPCS code H2014 than their peer average. Again, all of this is a result of data analysis. Um, and records were requested for the 7 members billed to determine if the services had been provided as billed and paid for. And the total payment at risk for this sample was $78,000. Um, so some more abnormal behavior. I was like, boy, somebody, the provider is off the chain and wrong for all of its wrongdoing, but somebody else didn't do their work. To me, it's clear somebody else let something slide and fail.
But
Go ahead.
the thing that gets me is like when you were talking, like when you mentioned data analysis, I'm like, these providers don't understand how easy it is.
It's easy.
I mean, because I'm just thinking, like as you were talking, I'm like, that is a basic count function in SQL or count if in Microsoft Excel. then based on the data, you automatically see the outliers.
Yes. Yes, and your Pepper report is only just a big Excel spreadsheet of all of the data analysis uh, your from that particular provider, comparing that provider to peers in the same specialty, comparing that provider to the peers across the state and across the country. That's all it really is that information. Um, and so anybody could do it. So the other part was, so here go the more suspicious abnormal behavior. Of course, the provider did not respond to any of the medical record requests. Of course, they didn't. The provider's website is no longer active. The provider's toll free number is now disconnected. And the local number is a cell phone that goes straight to voicemail. It's probably a Google number. Did I say that? I'm sorry. And phone calls were not returned. The owner is listed as a counselor. However, no license can be located. Again, somebody didn't do their work. Somebody didn't
Oh,
do the work. That
they
let
were doing
this
their big one.
somebody didn't do some other folks need to be pulled and called on the carpet related to this. Um, so all the sample claims were deemed not supported for failure to provide records, and the case was referred to the Office of Inspector General and Internal and Attorney General. The plan also plans to conduct an on-site visit to verify the provider's location and attempt to obtain medical records. Good luck with that, and I'll be following this if more things come out. This article came from Melanie Poole, who is, I guess, the fraud, waste, and abuse director at Cotivity. Yeah, yeah, she's with them. So yeah, I'm confused. I have no idea how these folks got into. Somebody didn't do their job. That's all I'll say about that. Let's see what's going on out here in these comment streets. She said it is the audacity. Yes, ma'am. Yes, ma'am. She said, "Go ahead, data expert Jesse." All of them were reckless. Yes, and all of them should be called to the on the table. All of them. Good morning, Lee Love 35. Welcome, welcome. Yes, they all should. So, of course, not only should these provide this provider or whatever, because clearly they out there doing something with the church's money, but these other folks who didn't validate all of this stuff prior to, which makes it worse and harder for everybody else. So I am real curious to know, at what state is this? Because over the states that I've dealt with, uh, have a very rigorous, strong system put in play that if you're thinking about doing something, at the bare minimum, your business stuff needs to be intact. Period. Now, if you do something outside of all of that, at least your business stuff is intact in order to get authorization to even bill for these services. All right, Mr. Jesse, you have anything on that?
No.
No.
I just the only thing I want to say is people have got to realize that the the days of the open bank are over.
Mm-hmm.
Like it's just you can't do what you used to do.
Mm-mm.
There's too
Mm-mm.
many checks and balances
It's
now.
too many, and I don't know what happened to some of them over here, but it's too many. And but this also is a case of, even if you get it off before in the front end, it's gonna come back to bite you on the back. So yeah,
Because them, shutting down their website and all this stuff, you can run, but you can't hide.
you can't hide. You are absolutely correct.
And they better not leave the country because as soon as they go through customs, they're going to be clinked. They try to come back.
Right. Right. Okay. So next I want to talk about I was talking about the skill facilities, the fiscal year 25 skilled nursing facility prospective payment system proposed rule. And what piqued my interest related to this was the nursing home enforcement. But before I tell you a little bit about that, the reason why this piqued my interest was because something that was coming out of the Health and Human Services Office for Civil Rights uh, uh, Division. So, the Office of Civil Rights enforce, let me just tell you a little bit about them. They enforce federal civil rights laws, conscious and religious freedom laws, the Health Insurance Portability and Accountability Act, we all know and love as HIPAA, privacy, security, and breach notification rules, and the Patient Safety Act and Rule, which together protects your fundamental rights of non discrimination, conscious, religious freedom, and health information privacy. OCR protects your rights by teaching health and social services workers about civil rights laws, conscious and religious freedom laws, health information privacy, and patient safety confidentiality laws. Also, educating the community and investigating civil rights um, complaints to identify whether or not discrimination or a violation of the law is taking place and taking the action to correct the problems. So, the reason why this was interesting to me. Oh, and let me just tell you, um, their the leader of this division is Melanie Fontes Rayner, who is the director, who was at our AHIMA advocacy, who is off the chain. I loved her. I loved her. Um, and she's playing no games with anybody. And she's well equipped and ready to serve. I'll say it that way. But anyway, so the reason why all of this um, was for me interesting was because um, they then imposed a civil monetary penalty on a New Jersey nursing facility for failing to provide timely access to their patient records. So they got some teeth. They have some authority to do some things. Um, so this was from the Health and Human Services. It was a press release that came out April 1st on April Fool's Day, but it was a real thing. So Essex Residential Care LLC is to pay $100,000 after failing to comply with HIPAA right of access. Um, Again, this Essex Residential Care LLC, doing business as Hackensack Meridian Health West Caldwell Care Center, is a skilled nursing facility that provides long-term care and rehabilitation services. The Office of Civil Rights, or OCR, investigated Hackensack under the under HIPAA privacy rule for failing to provide a patient's personal representative with timely access to the patient's medical records. Now, I don't know if y'all know about all of this, but you can request your records, and there's a whole slew of rules and regulations on how you can request it and how you are supposed to get them and all of the things that need to do. Well, all of that falls under the purview of the Office of Civil Rights. And so when you don't get what you need to get and how you need to get it according to the law, you can make a complaint. Your voice always matters. You can make a complaint, and then they'll investigate those complaints. And if they see something or find something, here we are. So, again, in May 2020, they received a complaint alleging that they failed to provide a personal representative. And a personal representative is someone who is actually speaking for the patient if the patient can't speak or act for themselves, with access to his mother's medical records. The records were allegedly withheld even after Hackensack Meridian Health received sufficient documentation demonstrating that the son was serving as the mother's personal representative. The requested records were sent to the personal representative in November 2020 as a result of OCR's investigation. They needed them in May, requested them in May. They got them in November. Who does that? Okay. So, the OCR found that they failed to respond timely to the HIPAA right of access request. Um, And so in September 2023, OCR issued a notice of proposed determination seeking to impose a civil monetary penalty. Um, the organization waived its right to a hearing and did not contest the OCR's finding, and accordingly, the OCR imposed a civil monetary penalty of $100,000. And then you can find all the details, and I put the link in the description. All the details of the proposed determination, all of that, da da da. So that was curious to me because in the new proposed rule, they got a whole bunch of stuff on nursing home enforcement. And so it has some things that includes revisions to um, their existing nursing home enforcement authority to enhance the safety and quality of care provided in the nation's nursing home. And so there, in February of 2022, Biden-Harris administration signaled a commitment to ensure that all residents living in nursing homes receive safe, quality care. And so CMS is proposing to expand its ability to impose financial penalties to drive sustained correction of health and safety deficiencies. These revisions will allow CMS to expand the mix and number of penalties in response to situations that put residents' health and safety at risk, and therefore encourage facilities to promptly correct and maintain lasting compliance with CMS's health and safety requirements. Um, Current enforcement allows imposition of civil monetary penalties for noncompliance. These penalties can currently be imposed per day or per instance, depending on the health and safety deficiencies identified. Um, However, one of the things is that the per day or per instance penalties cannot be imposed during the same survey, and per instance penalties may not be imposed concurrently for the same deficiency. That's what they have going on currently. Well, in the proposed rules, they want to expand the penalties that can be imposed through regulatory revision to allow for more per instance and per day CMPs to be imposed. So the proposals in this rule will permit both types of penalties to be imposed and not to exceed the statutory daily limits, providing CMS with greater flexibility to impose penalties in a manner that more directly reflects the health and safety impact to residents and incentivizes permanent correction. Um, because this is a proposed rule, they're still in comment period. I think the comment period is in May, I believe. I'll double check that. But yeah, so that was the one thing that I said, oh, wait a minute. They got a whole enforcement. You already got some folks doing some things with the Office of Civil Rights. They coming for the nursing homes. They've been talking about it. And now they're putting together the plan to do that. So nursing home folks, get it together. Um, they also are doing something with matching for ICD-10 code mappings. Um, they use the patient-driven payment model for these mappings, and they are proposing some changes to those mappings to allow providers to provide more accurate, consistent, and appropriate primary diagnoses that meet the criteria for skilled interventions during a Part A SNF stay. And so,
Can I just interrupt this?
because I'm done.
You know, they did a whole the CMS did a whole revamp of home health, because when you said PDGM, they started that in home health. I want to say maybe 2021.
Mm-hmm.
So now they have moved it to skilled nursing.
Mm-hmm.
And every time I hear about these little, progressions, I think about years ago, I had heard that CMS eventually they wanted everything to be risk adjustment.
Mm.
And they're moving towards it because,
Mm-hmm.
home health was, was a huge step. And now once they do SNFs, that's everything part A. So,
Everything.
except for,
Who said I want that?
hospice. But
Well, that
hospice
may
is
be
part
coming
of
next
home
too.
health. Yeah.
I'm sure that's coming as well.
Yep.
Yeah. And so you're being, if you're operating in a SNF, and the issue that, so here locally, we're seeing all kinds of stuff in the SNF world. Unfortunately, um, some of these skilled nursing facilities in these marginalized urban areas that impact folks of color, folks of low socioeconomic status, deplorable. Can I just say deplorable?
Right.
Um, and some of them really do need to be closed or fined or whatever to bring the quality to something. I mean, my thing is, I'm sure you wouldn't want to put your parents or grandparents or family member in some of these places. You don't live like that. Why would you want these folks to live like that? It's horrible. I remember somebody posted on Facebook. It was either last year or the year before. Um, they were giving them dinner, and the dinner, first of all, the snob in me, I don't like paper plates, but that's a whole other conversation. But they gave these people um a paper plate with a bologna sandwich and some chips, and that was dinner to all of the residents. They were like pass. It was like, remember the Peanuts Thanksgiving when Snoopy had the popcorn and the toast? They was just passing them out like, and I'm like, I know there's a per diem rate that includes the meals that are supposed to come. Where is the food to pay to feed the people who need to be fed? I don't understand that. So the sad and consequence of that is, because the folks refuse to do right or can't do right or whatever, the money is not moneying, so they get out of the business, then the place closes. So then there are less and less places for the people to go. Um, and oftentimes some of these private institutions, they don't take Medicare or Medicaid. Um, or they only take a certain number of beds. So it's very, very limited for you to be able to get in. And that window is shrinking, because as soon as a bed comes open, somebody running trying to get it. And so again, because it's so few, um, it's bad. I know there's a huge push for patients to kind of stay home, be able to get care at home, probably partly because of the conditions of some of these facilities and the lack of facilities that are available. So it's a whole cycle that needs some attention. Um, that hopefully in some of this rulemaking, these policy making, um, that the folks who are operating these facilities can take notice of, and at least in some of these areas, do the right thing.
Well, you know, long term care has been messed up in this country forever. And I think that all this is all well and good, but all they have to do, if they could fix CMS and the government could fix this on Monday. All you have to do is have mandatory staffing minimums.
Hmm.
But they fight it because they want to be able to keep profit and feed people bologna sandwiches. Because in addition to the food being horrible, I worked in nursing homes. I want to be very clear.
I worked in a nursing home too. I
They
was a
don't have
unit
enough
coordinator in a
people.
nursing home.
They don't have enough people to even feed people.
I had to feed people, and I have no
Exactly.
skin. They was like, "Could
Exactly.
you come over here and feed Miss So and so and so, or could you walk her down the?" I mean, so I'm like, but I'm supposed to be sitting here at the desk for the people. It's just us, or they have agency people in there. It's
It,
a
it
whole
is. It is.
environment. It is. You're
I mean,
absolutely correct.
one of the worst stories. I was working agency at this nursing home, and they bought up this man. They sent the wrong tray because some people have to have
Soft
mechanical
mechanical.
soft. Yeah, exactly.
Mm-hmm.
So they sent up the wrong tray, and I'm like, well, it's like what's taking so long? So I ended up, you can make any. I mean, thank God I'm a nurse. I know how to mush it up and make. So I fed that man this entire tray. He ate it like he hadn't eaten in days. They finally bring his tray. That man ate his other tray too. And
He
I'm
might
like,
not have eaten in days.
exactly.
For
And
real.
that's the first thing
He
I
gonna eat
thought
anything
about.
you put in front of him because who knows when the next time he gonna see a meal. That's a cool.
Exactly. Oh, and then like I'm going to get off my soapbox, but my number one pet peeve, and I used to go berserk in long-term care. Nothing used to drive me more crazy than right after meals. I'm walking down the hall. These people laying flat as a pancake. How are they supposed to digest that food? You'll call me at 10 o'clock when this person aspirated.
Right. Right.
I'm done.
No. So while we normally talk acute care and whatever, it's all part of the healthcare continuum. And at some point, we are all involved and we all touch this, either as a consumer or in our roles in health information, and our roles as advocates for um, the patients, in our roles as even frontline providers. Like it's all relative. And at the end of the day, I tell folks all the time. I posted in, I think it was on LinkedIn. Posted my throwback compliance shirt. Like, compliance is not a dirty word. We all have to be involved in compliance, and making sure that we are doing what we are supposed to do as it relates to our consumer, our customer, which are our patients. It's it could all be so simple. Makes me go back to that. It could all be so simple, but you rather make it hard. I don't
Rather.
get it. I don't get it. All right. All right. Let's see. I'm trying to make sure I check all the folks. Any comments? Any else? Well, those are my two topics for the day. Look at us doing it all within the hour. I'm so proud.
Yeah, they're very timely topics. Oh, and also, um, Hackensack Meridian Health. That's that's the um that's the hospital system that I cover.
Well, these health streets are smaller and smaller. You never know. Wow. Wow. Interesting.
And
Interesting.
speaking of these streets, you know what is how why is it that Change Healthcare was front and center, all up in the news? Now you don't hear anything. Like what
It's like
happened?
one off. Like, if you go to somebody's website, you might get a pop up, hey, change health, da da da. Because I think there was some foul stuff going on there too. Don't I think there's some foul stuff happening as it relates to that as well. I just do.
I believe you. I did look. I don't put anything past any of these
Mm-mm. And I
organizations.
don't think it's over. I think the impact, there's still going to be some residual impact, like the aftershocks. There're going to be some aftershock as it relate to that. I don't think it's over. And throwing money at it, is that the right thing? Is because these folks, they can't get paid. You'd have provided the service. Yeah, she's like, it's a conspiracy. I feel that in
Mhm.
my spirit. Something. There's more to it than what's being said. And to your point, folks then got real quiet, real quiet. And maybe they're quiet because they're working to change what's going on. The optimist in me wants to believe that. Probably they not quiet because they trying to uncover or cover up and do that 3 card Molly thing and shift stuff all around. Preferably that's not the case. Mm. Things to think about. Things that make you
Yeah.
say, Mm-hmm.
Good Lord. All you got to do when you follow the money, man, that's a rabbit hole and a half.
Where the money resides. Where the money resides. Oh. At the end of the day, that is that is what is happening. All right, y'all. Well, the tea spilling has commenced. And thank you all for joining the Saturday morning tea or checking out the replay. Was the tea spilled today? Well, guess what? There is more tea to be spilled. We will be having our meeting after the meeting, starting at 10:15, where we discuss more on these topics and others. We have expert Q&A sessions, as a member of our Patreon, and I'm still thinking of a little name. I'm thinking something around collective, something around curator, something around all of those things. I'm still uh, a tea collector. I don't know. I'm still trying to figure out something that's catchy and cute that we could have emojis for. Anyway, we also provide insider tips. We talk in entrepreneurism. We talk AI. We talk all of the things where you have exclusive content and networking opportunities. Things may come up. Hey, I know so and so. Let me put you up on game. And here's an opportunity to do that. So check out our Patreon to become a member today. And that's where you'll get the information and the link for the meeting after the meeting to join us. So anyway, was the it's like, yay. Oh, what she say? If y'all listened to that link last week, that's why they quiet. Probably. um, let's see, they're changing and covering up at the same time. Exactly. It's something going on. Something going on. I believe it. I believe it. I believe it. And here's our teas. Yay. Okay. So if this information was valuable for you, help us share this information with your colleagues and others who may need to know that we are out here in these streets and we giving it to you raw, uncut, and strong in a 3 tea bag cup. Yeah, I got 3 tea bags today. um, and so you can do this by, again, sharing the video with people, subscribing to the channel, letting folks know about the channel. Also, be sure to follow us for more information on all things health information, compliance, revenue cycle, and medical coding. And as you leave, don't forget to hit the thumbs up or like button.
Oh,
Give us some engagement. Let us know you are here. Also, check out the Coding Nurse channel on YouTube. Mr. Jesse, did you have some final thoughts that you wanted to provide?
yeah. Before you
Bless
go,
you.
we have a comment. Thank you from Tamara.
I'm sorry. Oh, hi, Tamara. Let's see. Coding out a sniff claim is a whole animal. Yes, especially if they don't confirm the patient is in a sniff prior to the claim being denied. I have to create 2 separate claims and enter the information on Conic. Lord, it's a whole thing. You are absolutely correct. And my hat's off. Because this is kind of one of those non-traditional health information roles. I remember when, like I said, I worked at the nursing facility as the unit coordinator, but I was assisting. Part of my role was to assist because there's like one health information professional that's doing all of the things and responsible for the documents. Well, this was, I'm dating myself. This is pre EMR. But she had to put together all the charts and all the documents and the making sure that the charts were thinned and storage and all of the things and the coding and the billing, all of the things. She a one woman person was responsible for this particular facility, which was, we had 3 floors of folks, plus some assisted living, plus some all kinds of things. So it's a lot going on. And you talk about gatekeeping. this was a this was a specialty uh uh um club, country club of folks that you be like, well, well, who is the person? Well, who? How do you get in? How? And if you didn't know the people, you were not getting in. And some of those people are still here today. So yeah.
Because actually, we might want to bring Tamara on because I've never known anybody to do sniff claims. So that might be interesting.
Really? Well, yeah. That would be a different perspective. I love learning about the different perspectives of folks doing some things. So, um, definitely, definitely, Miss Tamara Denise, feel free to reach out. Wait a minute, she said more. Mr. Jesse said it best last week. They don't prepare you students for this during the exam because it's not coding perfect claims. Exactly, exactly. Or even coding for these types of claims. Um, most of it is either around, depending on what your if you're going for certification, what your certification is around. They're not looking at sniffs or even home health or behavioral
Exactly.
or all of
Well,
the
Tamara,
different things.
reach out to me or Clarice on the back end, and we'll set something up so you can come in
Definitely.
and do a little, give us a little rundown.
That's right. That's right. Or we can invite you to a meeting after the meeting session where we can, if
That
folks want to
too.
come in, and we can do that as well. So definitely you can provide some information and some insight. All right. All right. Well, this was good. This was good. I
Yeah.
appreciate y'all being here. Don't forget, next week we won't have a live, but I will have something put together for you um, to keep you in the loop and informed on what's going on out here in these healthcare streets. All right. Well, this has been a great session today. Thank you all. Oh wait, you are absolutely correct. They don't prepare for dentistry or ophthalmology either. Both places people are needed. Yeah, those are specialty areas. Well, folks think that's a whole other conversation. How do I get in the meeting? Um, Tamara, send me, send me an email. Here's my email address, so you can send me an email, and I will send you the link. She's absolutely correct. Yes, yes, yes. That is all of the things. All right. Okay. Well, again, this has been a great session today. Thank you for joining. And remember, be safe, be kind, and don't wish for it, work for it. Until next time, have a great weekend and take care.
Bye bye.